located in Ludington and Manistee.
102.7 WMOM 722, 22 minutes after 7 o'clock. Welcome to it. It's the morning show. Chris with you, and so is Dr. Andrew Riemer. How you doing, sir?
Hey, great, Chris.
And thanks for coming in today. We've had you in before, and these segments are always interesting because I learn a lot as somebody that wears contacts and glasses and is aging like everybody else out there. But today we are talking particularly about aging and our eyes. And this has come up from time to time about how as you get into your 40s, 50s, and such, things change with your eyes. And is it a natural thing that always changes? I mean, is there anybody out there walking around that has just the same eyes that they did when they were 20 years old versus 50 or 60 years old?
No, they don't, Chris. Thanks for having me, though. But yeah, we think we're not going to have our eyes age, but it doesn't matter what kind of shape you're in. Your eyes get old.
Yeah, absolutely. Just like everything else. We get some wrinkles from time to time. We get all that. But this morning, we're going to be talking about aging eyes on the segment that you can watch right now on our Facebook Live, YouTube Live, as well as listen to on your smart devices like your Amazon Alexa, your Google Home, streaming at WMOM.FM, and, of course, over your radio this morning. Dr. Riemer, thanks for coming in this morning, by the way. And
thanks for having me.
Yeah, absolutely. Let's talk about probably the one thing that as we age that really stands out, that changes. Do you mind starting right there?
Yeah, so when we get into our 40s, we lose accommodation, that is focus. So if you have neutral vision and you have good distance vision, maybe all your life, and you think this is great, I'm doing fine. When you get into your 40s, there's going to be a magic birthday where you wake up and you go, I can't read. This is a problem. So that's presbyopia as a term. The lens is flexible in the eye, and there's muscles that make it move and change shape. And when things stiffen up in there, the lens doesn't change shape so much. So then you have to use glasses to make up for that. So you're going to be wearing the reading glasses if you have neutral vision for distance. And as time goes, that you become more dependent on that. If you're nearsighted, on the other hand, you don't have that problem. So nearsighted friends will be, hey, I can still read, but they're putting on glasses for distance. But the point is you need to get your eyes examined at some point. And at age 40, everybody should have a dilated, thorough eye examination to look for any pathologies that are starting and as a baseline.
And not to personalize everything with myself, but literally going through that phase right now. And here's how I know that is because I'll take my cell phone and I'll put it about right here at this distance, and I can't read it. Literally can't read it, and so I've got to extend it a little bit there.
That's right.
But that's natural, and then we have to look at a different prescription, I would assume at that point, or the changes in what we wear with contacts and glasses.
Right, and then you're getting a bifocal, or you're getting a pair of readers at that time.
Yeah, and which in some cases people are like, oh, now I'm old, but the technology is very much different than seeing those lines in that lens, right?
That's exactly right. So you can get glasses that make up for that without lines, but more importantly, when you get your eye exam, you might have something else going on. So if there's a cataract forming, that's part of aging. That's where the lens in the eye becomes opaque and cloudy. And when that happens, then cataract removal it can take place. And that happens, I see people in their 40s every week that have cataract surgery, even at young ages, from trauma, from inflammation, from diabetes, from other conditions, inherited or not, that will cause your lens to become opaque or cloudy. And the lens replacement is what we do for that. And that's a very common procedure, one of the most common procedures performed today.
Yeah, and with that, do people don't have to wear? Do they? Well, they do have to wear corrective sometimes, right? Or no?
Yeah, most people nowadays, when they have a cataract, can have their cataract removed and a lens replacement. But the lens replacement can be a multifocal lens. It gives you distance near, or an extended depth of focus lens. It gives you intermediate distance. That's a very common thing, and it's really a great thing happening in terms of technology. In the days, 20, 30 years ago, everybody was having LASIK. Well, LASIK was a procedure where you changed the shape or the curvature of the surface of your cornea, and you flattened it to make it make the distance for focus in the eye, so that you have neutral distance. You get rid of your glasses.
Yeah,
but it doesn't do anything for your near vision.
Okay.
And so when you get into your 40s after LASIK, you're wanting that near vision back. a multifocal lens is a way to do that. Some people will even have their lens removed before a cataract forms to receive a multifocal lens so they don't have to have glasses for distance or near.
Wow. And that's something that you just cleared up for me as well, because I thought that when you had surgery on your eyes, that was that LASIK. But there's two different kinds of surgeries out there, and it sounds like maybe LASIK is of the past then?
Well, LASIK is great if you're less than 40 and you want to get good distance vision back.
Okay.
And if you're nearsighted to start. But now the multifocal lens is used as a surgical procedure to help you get the distance near and in between. And that technology is always improving. They're getting better every year. But on your exam, it's also important that when you have your exam that you are there to identify pathologies. And glaucoma is something that happens at a greater prevalence as we age. 2 to 3% of the population at some point can develop high eye pressure that causes nerve damage and vision loss. The problem with glaucoma, and we discussed this before, Chris, is that you don't know you have it unless you have a very high pressure or have a very severe stage of vision loss as a result of having the high pressure. So that's where an annual examination that's dilated with a nerve is examined and is important.
Okay, all right, and that should again you emphasize annual, and that when that happens, I mean that is something that in your 40s, 50s, 60s, it doesn't stop just because hey I got my glasses and I've got my prescription. We should not kind of soar through these years just because we can see okay at that point, right?
Yeah, we get a good baseline. So you get your baseline at age 40 or sooner, but you should have that. And then based on what we find in the eye, we may say, hey, you have a family history of macular degeneration that's early. And then we look at the back of the inside of the eye and the retina, you go, hey, there's some early changes there or not. That might prompt us to say, well, you need an exam more frequently than that, and we need to do studies at the time of examination to determine if it's a wet or dry type of macular degeneration that develops. And you can look at your parents and say, hey, what happened there? And a lot of times you may know that they had glaucoma. They used eye drops for pressure. They had macular degeneration with vision loss or cataracts. And those are these things that happen with the aging eye. So identification of those things early on can help you prevent those. For example, with macular degeneration, there's therapies for the wet, the dry kind, and the wet kind both. Injections are one thing, medications are another to help slow or prevent that and treat that once it happens, so you're right on top of it.
Absolutely, and we were talking on our last segment with your son, Dr. Brandon Riemer, here in particular about the wet and the dry of that, and the treatment process too. And this is something that people need to take seriously, not just the macular degeneration, but also just their eye care in general. Is there one more thing that stands out as we age that we need to? Because a lot of things, and I don't mean to go off to another trail here, but some things, as you mentioned, we don't notice. It doesn't show up, and that's where that exam comes into play. But is there, other than the vision changes, is there also some things that we should look out for as our eyes age that might stand out as a red flag, if that makes sense?
Yeah, there is. I mean, there's vision loss. So a cataract may give you cloudy vision, glare, blur, halos, difficulty in foggy vision with bright lights or headlights. But macular degeneration could give you distortion in the center of what you're looking at. So you could look at someone's face and have it distorted. Their face would be distorted, but you might see their ears and their periphery, but the center is distorted. So any visual distortion is also a key factor, especially when we get into 50s and 60s where macular degeneration becomes more prevalent. And that's a sign that says, hey, there could be some macular degeneration, which is the center of the back of the inside of the eye, the 20/20 spot, where you have your color vision, your sharp vision. That's called the macula in the center of the retina. So if you have distortion in that could be a lot of things. There's a macular degeneration is one of them, but also a diabetic retinopathy. You could have other causes of vision distortion, puckers or membranes and so forth, things that can happen inside the eye that can cause vision loss. So that's a key. You want to get in if you have that also.
Here's a question. Take us through the inside as a doctor. Is it easy for you to diagnose these different things and truly separate them, that this is what you're going through here? Or can things overlap a little bit there?
Yeah, when I was next door here, when I came here in 1994, Chris, I was like the next building over. It was more difficult. It was basically, bright lights and lenses, and you're studying the inside of the eye with just, lenses and magnifiers. But today, the technology is amazing. We have some great technology that can do, like a CT scan looking image that you're going to get, OCT it's called. But you get images of the retina and all layers of the retina. It's amazing what you can get. So the exam is more than just a look. There's tests that you can take that can identify pathology in every stage, early stage, and every layer of the inside of the back of the eye, including the layers of the lens and the front to the back, the iris, the lens, and the retina.
Okay, all right, and it's good from your standpoint and from ours that technology is there because it makes it easier, and it makes it easier to diagnose it earlier than
correct. You catch things early, you can identify it, then you can follow progression. One study can be compared to another study when you're following diabetic retinopathy or macular degeneration in the retina and so forth.
All right. Anything that we missed talking about in regards to aging eyes? Anything that we can do without having to come see you, if that's okay? And then obviously we want to come see you for the exams, but anything that would help us? Can diet, can any of that kind of stuff factor into some of our? They talk about carrots for the eyes. Is that true, by the way, or not?
Yeah. Well, there are certain vitamins that have been studied over a course of time that can help prevent macular degeneration. In fact, if you have moderate degeneration, there's one called age-related eye disease study, AREDS vitamins that have 5 or 6 vitamins and minerals that do actually help.
Okay.
But in general, what's good for your body, what's good for your heart, is good for your eyes.
Okay.
And so you're gonna, the antioxidants, healthy eating, healthy diet. If you know that to be good, that's probably good for your eyes.
All right.
1 glass of red wine, not 3, and antioxidants and carrots. Yeah, the vitamin A, if you're deficient, especially, is the thing.
Okay. Anything else you want to add? And before we wrap up.
Yeah, I want to say that make sure you get your eyes examined, and that can tell you a lot of things. There's so many things that can be occurring in your eye at early stages that you'd be unaware of, and we mentioned those. The pressure check, the cataracts, the macular degeneration, things that happen when you get older. And if you catch them early, you're going to be preventing them and treating them in a way that's going to be effective in helping you maintain good vision. So if you're 40, get your eyes examined. If you're over 65, you should every year, regardless of your eye health.
All right, and it's not just the puff of air anymore, right?
It is not.
All right, good to know. The technology is there to make sure that our vision is it's good for a long time, the rest of our lives, hopefully, right?
Correct.
All right, Dr. Andrew Riemer here in the studio. If you missed any of this segment, by the way, you can watch it in its entirety on our Facebook page and our YouTube channel. Check that out when you get a chance. And more importantly, as Doc had mentioned, get that exam done. And you've got multiple locations within the listening area to do that. Right here in Ludington, you've got Manistee as well as Cadillac. So you know what? There shouldn't be an excuse to get in and get that exam. Should there? No?
That's
no,
right.
Absolutely. All right, Doc, thanks so much for coming in. We appreciate it.
Thank you. Nice to have it.
Absolutely. It is now 7:35 on 102.7 Mom FM. Stick around. We've got more music on the way. And check your weather forecast as well on 102.7. It's Mom FM.
Looking for a career rather than